Thank you for joining me today. In this video, we are going to learn more about sleep-wake disorders. What causes sleep disorders? We are going to apply a DSM-5 treatment and diagnosis criteria for sleep-wake disorders. We are going to differentiate psychiatric symptoms caused by sleep disorders from primary psychiatric disorders. We are going to perform comprehensive assessment. We are going to interpret sleep rating scales and screen tools. We are going to understand neurobiological and circadian regulation. We're going to develop evidence-based treatment plan integrating behavior, pharmacology, and medical interventions. We are going to select appropriate sleeping medication based on patient criteria and risk profile. We are going to apply lifespan specific approach for children, pregnancy, and elderly adults. So overall, sleep-wake disorders. Sleep is a biological process that is essential for emotional regulation, memory, consideration, cognitive function, immune regulation, hormonal balance, cardiac health. Sleep disorders is frequently present as a psychiatric compliant, include depression, anxiety, irritability when the person didn't get enough sleep. They show up as a depressed, anxious, irritable, poor concentration, mood unstable, psychiatric-like symptoms because they are not getting enough sleep. Either they feel those symptoms or because their body is not able to regulate emotional, that is how they present. That's how they show up. So clinicians must determine whether the sleep disturbance is a system of other psychiatric condition or if it's primary sleep condition or medical or substance usage affecting the sleep, or there is a medical condition. When you want to assist the patient, you want to know what caused this sleep disturbance. Is this from psychiatric condition? Is this caused by a sleep condition? Because there's a sleep condition, is there a medical or substance that causing the sleep disturbance, or there's a medical cause of the sleep conditions? Sleep regulatory system, circadian system. Sleep is controlled by the circadian system, melatonin secretion, light and dark circle, SCN, nucleus, hormone and sleep driven, accumulation of sleep pressure increases with time wake. Accumulation of sleep pressure increases with time wake. Regulated by the reason accumulation and sleep deprivation. So when your body didn't get enough sleep, that is when the accumulation of sleep pressure increases with time. So the neurotransmitters that involve in sleep that promote wakefulness are dopamine, norepinephrine, histamine, oxytocin. So dopamine, neurotransmitter dopamine, involves alertness, motivation, and it's involved in wakefulness. Histamine is also involves wake maintenance, maintaining wakeness. Oxytocin stabilizes wakefulness. Gabapentin, what I mean GABA, not gabapentin. GABA promotes sleep. So GABA is the major inhibitor sleep neurotransmitter, GABA. Target of benzodiazepine and C drugs. Melatonin also regulates circadian rhythm. Serotonin improves sleep also, and it involves sleep initiation, mood regulation. So melatonin, GABA, and serotonin improve sleep. Oxytocin, histamine, norepinephrine, and dopamine improve wakefulness. Diagnosis and evaluation of sleep disorder involve comprehensive sleep assessment, history of sleep schedule. You want to assess the patient if they are getting enough sleep, how they sleep, the history of their sleep, when did this begin, what is the schedule of sleep, what time they went to bed, what wake time. You want to assess the bedtime, wake time, sleep late night, wakefulness, and total time sleep. Then you want to assess the sleep quality. How rested do you feel when you wake? That's the question you ask the patient. How restful do you feel? You could be sleeping a lot of hours, laying in bed a lot of hours, but you may not feel restful. You may not feel that your body is getting enough sleep. So that's what you want to assess. Daytime symptoms. You want to assess the daytime symptoms like fatigue, sleepiness at daytime, poor concentration, irritability daytime. You want to assess the behavior factors like screen used. If the patient is using screen time like computers, telephones, coffee, how many coffee they drink at daytime, and alcohol, if they exercise, shifted they work. Those are the what you want to assess, and those are the one you want to educate the patient to improve. If they spend a lot of time daytime screen time, you want to scale back, and you want to encourage them to have less screen time. If they been drinking a lot of coffee, you want to encourage them to have a lot less coffee, especially close to the sleep time. If they are drinking alcohol, you want to encourage them and educate them not to drink. Exercise, you want to encourage them to exercise during the day so they can get tired and get enough sleep when they sleep. The shift they work, the shift you work will affect your sleep time. You may work night shift and it's hard for you to sleep daytime. That can affect your health. So you want to know what caused this sleep disorder. You want to also assess the medical factors that cause this sleep disturbance. Is there a pain involved? If the patient is in pain, they cannot sleep. Thyroid diseases can affect the sleep and can cause sleep disturbance. Menopause, if the woman is going through menopause, it's hard for them to get enough sleep because the hormonal balance. Respiratory disease, it's hard for the person to get enough sleep if they have any respiratory distress because they are scared of suffocation. When they don't get enough sleep, they will be weak. Their body will wake because they cannot rest. You want to assess the psychiatric disorders such as if they are having a depression, anxiety, PTSD, bipolar disorder, ADHD, substance abuse disorder. All these factors cause sleep disturbance. Your work can cause sleep disturbance, the time you sleep, the coffee, screen time, substance usage, ADHD. So psychiatric factors, medical factors, behavior factors, and daytime symptoms. You want to assess all that because those factors will affect the sleep quality and sleep time. Then the skilling or screening tools that you want to use. So sleep rating scales. There's a sleep rating scales that you can use to assist the patient. The sleep rating scales include insomnia severity rating, or it's not insomnia severity index. ISI, sleep insomnia severity index. Insomnia severity index assists the quality of sleep. Insomnia severity symptoms, sleep difficulty. It assesses the daytime function. It monitored treatment response. It is insomnia severity index. So it assists the quality, it assists daytime function, it assists the symptoms, severity of the insomnia, treatment response of the insomnia. There is a sleep rating scale, also called PSQI. PSQI assists the sleep quality. This is a fixed sleep quality index. It assists sleep quality, duration, disruption of the sleep, daytime function. There is a Epworth sleepiness scale that you can use to assist the patient or client. It screens the excessive daytime sleep, improve narcoleptics and sleep apnea. There is a stop bank questions that screens obstructive sleep apnea and that assist the risk factors such as snoring, tiredness, obstructive apnea, hypertension. What causes the obstructive sleep apnea? That's what it is, what it assesses. So it assesses snoring, tiredness, obstructive apnea, hypertension, weight gain, age, neck circumference, and gender. The sleep rating scale, other sleep rating scale include polysomnography, and that is the gold standard of assessing sleep apnea. Narcoleptic evaluation, parasomnia with concerning for seizure. It measures the sleep, it measures the respiratory effort, EEG for the heart rate, oxygen saturation of the body, it also assists the sleep stage. Insomnia disorder. Insomnia disorder is a persistent difficulty initiating sleep and maintaining sleep, or is achieving a restorative sleep despite the enough sleep, adequate sleep. So insomnia disorder itself is a persistent difficulty initiating sleep, maintaining sleep, or getting enough sleep, restful sleep. DSM-5 diagnosis criteria assess difficulty in insomnia is difficulty initiating sleep, difficulty maintaining sleep, early morning weakness. The associated daytime impairment include fatigue, cognition impairment, mood disturbance, reduced function. Clinical presentation of insomnia include nighttime symptoms and daytime symptoms. Nighttime symptoms include prolonged sleep latency, frequency weakness, early wakefulness. Daytime symptoms include fatigue, irritability, mood, poor attention, memory problem, anxiety. Differential diagnoses include major depression disorder, general anxiety disorder, PTSD, bipolar disorder. Medication that affect sleep include stimulant, corticoid or cortisol medication, decongestants, restless leg syndrome, sleep apnea, cardiac rhythm disorders. So when you want to assist the client for mental status findings such as appearance, fatigue, behavior, slow mood, exhaustion, irritability. So the first line of therapy for insomnia or sleep disorders include cognitive behavior therapy for insomnia. You want to control the stimulation. Sleep restriction, cognition therapy. You want to target the catastrophic belief about sleep anxiety, relaxation training, sleep hygiene. You want to recommend sleep hygiene, and recommendations include consistent wake time, avoid coffee afternoon, avoid alcohol near the bedtime or at all, reduce screen time, dark, cold. You want to make your room dark, cold, and exercise daytime. Medication treatment for insomnia include melatonin, Remeron, low dose of dexapine, orexin agencies, orexin antagonist medications, Z-drugs such as Zelbaidan, Zelbairam. Z-drugs that include Ambien, Lunesta,